Happy morning, everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming NORCET exam. So you all know that NORCET exam going to come in the September. This time, along with the NORCET, we are expecting JIPMER vacancy also together. Okay, so there will be huge vacancies will be there because all the aims as well as JIPMER. So you put all your effort to succeed. Okay. Today also we are going to see important MCQs which related to the JIPMER as well as to the uh, NORCET. Okay, we'll start today's session with a small quote. The best preparation for tomorrow is doing your best today. So last minute revision, last minute hurry to prepare a thing is not a way to achieve something. So do your preparation for tomorrow today itself. Okay, we'll start today's session. Today we are going to see a sign in X-ray. So in NORCET and all, we are expecting the image-based question, right? Sometimes they will give the X-rays, okay? So we need to diagnose what the exact diagnosis it is, okay? So based on that, we are going to see a importance MCQ. First question, in which condition related to this image? So they given the X-ray that apple core appearance of the colon. So which condition we can see this apple core cancer? The options they given colorectal cancer, colon obstruction, colostomy, and peritonitis. What is the exact correct answer? The correct answer is colorectal cancer. What is that apple core appearance? When we eat apple, so both the end, because we know we will not eat that center part, right? So that is called apple core lesion. So this is because of the colonic mass due to the colon cancer. When the colon is getting the cancer, so when we do the X-ray or a barium enema or a barium study, we can see this apple core lesion in the X-ray. You can see this. So not only that, colon cancer is a primary condition. We can see colon cancer. Other than that, we can see the Crohn's disease, ischemic colitis, tuberculosis, and amoebiasis, cytomegalovirus. In these conditions also, we can see the apple core, but primarily this colon apple core lesion is related to the colon cancer primarily. So how can we differentiate? So we need to do the biopsy to confirm the colon cancer, right? So according to this question, the apple core appearance of the colon is related to the option A, colorectal cancer, right? Okay, next question. Snowman sign seen in which condition? If we do the chest X-ray, we can see the snowman sign. So in which condition we can see? Options: pericarditis, pneumonia, tetralogy of Fallot, TAPVR. Okay. So what is the correct answer? The answer is option D, TAPVR. What is TAPVR? It is total anomalous pulmonary venous return. In this condition, we can see the snowman sign either in X-ray or a MRI. It looks like a snowman. That heart looks like a snowman. So what is this TAPVR, total anomalous pulmonary venous return? See, in our heart, in the left atrium, we will collect the left atrium will get the pure oxygenated blood from the lungs, right? Oxygenated blood from the lungs from the four veins. If anything abnormally, this four vein is connected somewhere other than this left atrium, it is called total anomalous pulmonary venous return. Once again, I will tell. In left atrium, we will have the normally four veins will come from the lungs to give the oxygenated blood. If any abnormal connection in this vein, for example, you can see it in this image. Here, supracardiac TAPVR, this is anomalous vein. This green color they have mentioned, this under anomalous vein. That is why it is called total anomalous pulmonary venous return. Other than left atrium, this anomalous vein will connect somewhere superior vena cava, inside the right atrium, inside the left ventricles, like that. It will anywhere it will collect. So it is called total anomalous pulmonary venous return. In this condition, we can see the snowman sign in the X-ray. Okay. So one more extra point I'm going to tell you. If the same snowman appearance which is seen in the MRI, in which condition? If it is X-ray, it is TAPVR. If it is in the MRI, snowman sign, it is nothing but it is called pituitary macroadenoma, the tumor in the pituitary gland. You can see this here. This is pituitary gland. If it is having the tumor, it will look like a snowman in the CT or MRI. Got it? If it is X-ray, it is TAPVR. If it is a MRI or a CT, it is pituitary macroadenoma. Don't get confused. In both the condition, snowman sign seen. One is X-ray, one is MRI. So tetralogy of Fallot, in the options we have given this tetralogy of Fallot. So if it is a tetralogy of Fallot in the X-ray, we can see the boot-shaped heart. Can you see it? It is a boot-shaped heart. What is tetralogy of Fallot? This 4 conditions together. Stenosis, pulmonary stenosis, right ventricular hypertrophy, ventricular septal defect, overriding of aorta. These 4 conditions together, we'll call it as a tetralogy of Fallot. Okay. So in this condition, in X-ray, we can see boot-shaped heart. Okay. Next question. What is the name of this sign seen in the abdomen? Panda sign, Mount Fuji sign, coffee bean sign, icterus sign. So tell me, this is the X-ray of the abdomen. So what is this sign? It is called coffee bean sign. Which condition we can see? In the sigmoid volvulus. So coffee bean look like structure, right? It is because of the distended sigmoid colon, right? Especially in the sigmoid volvulus, right? So that is coffee bean sign. It's look like a coffee bean. You can see it here. This is the patient with the sigmoid volvulus. It is look like a coffee bean sign. What is panda sign? What is panda sign? It is when we do the gallium study in the patient with a sarcoidosis. What is sarcoidosis? It's a granulomatous multisystem disorder. There is a granuloma will be present in the various part of the organs like lungs, limbs, lymphoids, right? And this granulomas will be present in anywhere in the organs. It is called a sarcoidosis. To diagnose it, we will do the gallium study. If you give the gallium and do the further radiological examination, this lacrimal glands, nasopharynx, parotid glands, it will observe the gallium. It's look like a panda face. So that is why it's called panda sign. Clear? Right. When it is, when the paratracheal lymph nodes, pretracheal lymph nodes, left tracheal lymph nodes are observing, it look like a lambda sign. That is not that much important. According to this question, panda sign. Okay, panda sign is seen in the sarcoidosis. Clear? Okay. What is on one more condition also we can see the panda sign, right? That is in the Wilson disease. If you do the MRI or a CT, we can see the face of the giant panda. That is a not simple panda. This is giant panda. Okay. So giant panda, we can see it in the Wilson disease. Clear? Okay. So next option they have given Mount Fuji sign. So this is Mount Fuji sign. It is seen in the hypertensive pneumocephalus. Hypertensive pneumocephalus. What is pneumocephalus? So inside the cranium, abnormally, anywhere in the brain, there will be a collection of gases. That means sometimes we can say air. Okay, air. So why it is happening? Some pathological changes happening, right? Due to the STH, MRI, some due to the surgery also, we can see this abnormal collection of the air in the cranium, right? Anywhere. It can be a subarachnoid, arachnoid, interventricular, anywhere it can happen. But it's mainly seen in the hypertensive pneumocamelus. We can see the Mount Fuji sign. It's look like a mountain. Right? Okay, next option they are given icterus sign. Everybody knows that ECPC it is due to the abnormal bilirubin collection. The high level jaundice, we will see the icterus, right? Okay. So next question, double bubble sign indication of what? double bubble. Can you see this double bubble? 1 second. I'll draw pen. Okay. So this is one bubble. So this is another bubble. Right? It is a double bubble seen in the which condition? The options they have given: congenital hypertrophic pyloric stenosis, duodenal atresia, jejunal ileal atresia, peritonitis. So the correct option is option B, duodenal atresia. Right? So how can we remember? We have single bubble sign, double bubble sign, triple bubble sign. Very easy. Easily we can remember. See, so according to our question, double bubble. So duodenal atresia. Duo means two. So two bubbles we can expect. So duodenal double bubble sign. That is the one. So in first condition, single bubble sign, single stenosis. So pyloric stenosis. Yes, remember it is single bubble sign, right? Yes, pyloric stenosis, single bubble. Duo, double. And last one, triple bubble sign. We can see it in the jejunal and ileal atresia. Jejunal and ileal. So three words are there. So we can remember triple bubble. So where and all this bubble can see in the stomach, duodenum, as well as in the jejunum. Three parts we can see the triple bubble sign. Clear? Yes. Okay. Next question. The thumb printing sign seen in which condition? Inflammatory bowel disease, colitis, diverculitis, all of the above. So what is the correct answer? It is all of the above. The thumb printing sign is nothing but because of the edema happening inside the colon, there is a pouches are forming, right? Because of the edema and inflammation, the pouches will form. Okay. Sometimes we call this folding and all hastrel folds. Nothing but it's a pouch, right? So it's look like a thumb printing, right? It is seen in the IBD, colitis, and diverculitis. Okay. Okay, that's all about today's session. I hope you like the class. So if you like the class, please press like button. If you have the if you are not subscribed our channel, please kindly subscribe our channel. Because the exams are going to come very within 2 to 3 months. We are going to get an NORCET exam. So we'll try to post more questions. For that, please kindly subscribe to our channel. Thank you so much and all the best. I'll meet you in the next session.